Welcome, everybody. My name is Matthew Davis. I'm the University Librarian. It's my pleasure to welcome you all here today. I'm just going to start with the acknowledgement of country. So, Damana, Guinea, Bungai, Wabakala, Badayuda, and Guinea. I'd like to acknowledge the traditional owners of the lands in which we find ourselves today, the Pamalong clan of the Awabakal people. Damana, Guinea, Narakal, Yanawa, Yanawa, Yalawana. So, I recognise the continued and enduring connection to the lands, sea and sky of this region of First Nations people, and pay my respects to the wisdom and knowledge passed down from the generations, from elders past to present. So welcome everyone to the library for this talk today, and special thanks to Professor Catharine Coleborne, who is with us today, and for a collaboration with Special Collections and Archives on the Say Art exhibition. It's currently showing downstairs, and you're all welcome to visit the exhibition after the talk and join us for morning tea as well. So I'd like to introduce now Professor Catharine Coleborne. Catharine is an internationally recognised historian of health and medicine with over 25 years of experience exploring the social and cultural histories of mental illness and institutional care. She is a fellow of both the Academy of the Social Sciences in Australia and the Australian Academy of the Humanities. Her extensive research portfolio spans the histories of colonial worlds, law and medical institutions. She has authored many books and attracted significant grant funding from the Australian Research Council and New Zealand's Marsden Fund. Beyond her research, she is a dedicated educator and academic leader, having supervised many postgraduate researchers, and I think it's 29 at last count, and served as a member of the ARC College of Experts. In this session, Professor Coleborne will present early findings from her new research into the Australian experience of poliomyelitis, polio, during the mid-20th century, and by examining public health strategies in New South Wales and how public health knowledge was disseminated, she explores how community advocacy shaped public awareness. I'd also recommend, if you have time, to read Catherine's latest article on the conversation. It's titled, "My Mother Survived Polio. Stories like hers show why vaccination matters," in which Catharine recounts her personal experiences of polio as it impacted society, including the memory of drinking a cup of pink liquid as a child, being of the first generation to take the oral polio vaccine. I'm sure that is a memory shared by many here as well. So can you join me now in welcoming Professor Catharine Coleborne?
Thank you very much, Matthew. What a lovely introduction, and thank you everybody for coming along. I feel very honoured and really, humble actually, because I am at the beginning of this research, so I think there will be people here who know, and I know there are, Howard, who know a lot about polio and who can put me in my research quest. It was also really lovely to hear you speaking in language, Matthew, to acknowledge country. Just yesterday I was giving a lecture to my humanities students in the Bachelor of Arts, and the theme actually is languages and communication. We were looking at Indigenous languages revitalisation, so thank you very much for that acknowledgement. So I'm also glad Matthew mentioned the exhibition downstairs, and if you haven't had a chance to have a look at it, I'd really love you to go down and have a look. And we've all been delighted with being able to use this particular image. My colleagues who were involved in the curation of that exhibition include Dr. Anne Hardy, Dr. Effie Georges, and Associate Professor Elizabeth Roberts-Peterson, and we had other doctors as well. And it's a terrific piece of work that draws on the library's collections, the special collections here, particularly the Copley collection. And the Copleys, as many of you will know, were very interested in selecting information about local issues, political issues, public health among them. So I think it's really worth you having a look at that. One of the other outcomes of that exhibition and that project was a digital history timeline on the Hunter Living Histories site. So it's a health and medicine timeline. And that was also curated by our researchers, students who were involved. But why did we use this particular polio image? And it's partly because the theme of public health did shape the exhibition. We were very interested in the way we could communicate the University of Newcastle's place in the development of public health through medical education, through outreach into communities, but also how public health sprang up around issues like polio or vaccination, but other concerns such as cancer, heart disease, and a number of other themes. And we also looked at something that I think is underexplored and a really interesting thing, which is home care, domiciliary care. And I think that's something we could be kind of pursuing a little bit further. And I do mention that in my conversation because my mother, when she was 7 years old with polio, was cared for at home by her own mother. So the image was scanned from a photograph in the 1958 Newcastle Teachers College photo album, and it is held here at the Special Collections. And the Newcastle Teachers College was used as a vaccination site in 1958, which highlights, again, those local efforts to control the outbreak of polio. So you can see how all around Australia, how some of these local sites for vaccination were mobilised. I've talked to a number of people who just sort of spontaneously tell me they remember where they lined up to go and get vaccinated. And what was Newcastle and the Hunters' experience of polio outbreaks? I haven't done enough research to tell you in detail, and some of you might tell me more. But focusing on a locality and what happened there can be a very useful strategy to uncover larger patterns of infection and community responses. So what we do know, or what I know so far, is that in the early 1950s, 1950 to 51, there was a major outbreak of polio, and polio was spreading through different communities in the extended Hunter region. And there was concern enough about this. There were newspaper reports, doctors and local health officials, everybody was getting involved, as they did all around Australia when these things happened. And in August of 1952, there was a letter to the Medical Journal of Australia from the Executive Committee of the Australian Orthopaedic Society that referred to the poliomyelitis epidemic in Newcastle in 1950 to 51. And they point to work that had been done as a superficial survey of treatments by Dr. Ethel Byrne and Dr. Alan Roberts. And this superficial survey detailed all the treatments on offer for local people who were infected by polio, who were being cared for in the aftermath. But the committee, the orthopaedic specialists, were critical of these treatments and the conclusions drawn by the survey, suggesting that they simplified the disease and could be harmful. And for example, they mentioned in that it was recommended that after the initial treatments and things, that people would go home and rest and recover. And of course, that was happening, as I know from my mother's story, probably fairly widely, although we also know many other people ended up in places like Prince Henry Hospital and other treatment centres. But the Medical Journal of Australia in 1952 had a sustained focus through its different issues that year on what had happened with polio in that early 1950s outbreak. And the concentrated interest and the contested nature of the ideas, the politics of it, reminds us of the instability of these ideas at that time. It wasn't necessarily the case that they knew everything, and neither do we, about how to treat diseases as they are happening in real time. Remember what happened during COVID. So treatments are not my main focus in this research, but they continue to define the knowledge landscape and the current thinking about post-polio as I continue to learn. On Monday afternoon, I was invited to attend a meeting of the Post-Polio Association members and sat with them and heard some of the advice they were being given about how to manage their symptoms later in life. So treatment will come into my research and it comes up today. But what I want to do here today in this talk is really explain the wider contours of my research project through a number of themes and how we might start to examine what we remember about polio as an experience in Australia. That's the subject of my new funded research. And shift our focus to the memories of disease. And that might be organisational practices as much as it is personal memories. And think about the way these help us to understand the significance of polio within our history in Australia. So that idea of Australia's experience of polio, the memory of polio in our country. So Australian historian of public health, Milton Lewis, has framed the history of public health as the story of the people's health. And in that, he builds on American historian George Rosen's concept of the biosocial nature of human beings. Rosen's work of 1958, so you can see in terms of periodisation coming out of this experience of polio too, published as A History of Public Health, was reprinted in 2015 and I think numerous times in between. And in the 2015 edition, there was an introduction by American historian Elizabeth Fee, and she was Chief Historian of the National Library of Medicine from 2011. And in that, she recasts the continued relevance of Rosen's scholarship. It's interesting to go back to the American historians because they were very engaged with social medicine in the 1950s and middle of the 20th century. So Fee argues for a capacious definition of the history of public health, one that's not limited to the study of bureaucratic structures and institutions, but pervades every aspect of social and cultural life. So therefore, public health histories are inextricable from questions of how people and whole populations might, to borrow from Fee, experience health and illness, or how social, political and economic structures shape the possibilities for healthy or unhealthy lives. Fee sees a strong relationship between these histories and the potential to influence contemporary health politics and policies, lending urgency to the use of an expanded definition of public health histories. So that's in part one of the, things that propels me in this research, the fact that we can translate history into something relevant for our present. And these ideas emerge and evolve from the mid-20th century. I think they're the hallmark of a generation of historians of health and medicine, and they signal the relationship between the rise of social medicine in practice and the growth of social histories of medicine in the scholarly world across America, the UK, Europe and Australia. So as I've started to investigate the social and medical histories of polio in Australia, I've been attentive to these themes that so clearly announce the vital and positive role played by public health authorities in their approach to disease by the mid-1950s. But I'm also curious about questions of medical power and cultural beliefs, especially as these unfolded in real time during polio epidemics. I also can't help but be struck by the terrifying and seemingly random hits made by polio on thousands of families in the middle of the 20th century. It's pretty stark when you get into the archive and look at some of these images, as well as records. But I'm also struck by the way organisations sprang up to provide care for the many crippled children, using inverted commas, who were affected and played their part in health education in the community. In more general histories of polio in Australia, historians observed that polio was a serious threat to children and that few objected to vaccination programs introduced in the mid-1950s. But this knowledge of both the threat and the role played by effective vaccination in the eradication of polio by the 1970s, not eradicated quite yet, has almost now entirely faded. These histories need to be more closely examined if we're to fully appreciate what one historian has described as the halting and layered nature of polio transmission. This phrase might also be usefully applied to community understandings of vaccines in the period. So people kind of understood what they needed to do, but it was also contested and people were nervous at the time. So what I'm going to do in this paper, and as I've said, is present some early stages of new research into the histories of polio in Australia. For those of you who might need a little bit of info, poliomyelitis affected thousands of people in Australia in the mid-20th century. It's an enteric virus, meaning it can be passed through bacteria such as intestinal bacteria, such as matter on unwashed hands, with children most at risk. It enters the nervous system and can result in paralysis or death. So my project, funded by the Australian Research Council, that part of it has only just started, the bigger project, seeks to research, locate and reveal people's experiences of polio and link these to the meta-narrative of health and illness at the national level. I'm focusing on the period 1950 to 1970 to reflect the most impactful outbreaks of pandemic polio infection and their aftermath as defined by Milton Lewis. So that period of the mid-20th century is the high point. And there are histories of the 1930s, and the 1930s background will feature in my research in some respects, but I'm focusing on that middle of the 20th century. So what I'll do here today is talk about some of my preliminary archival research that I've managed to conduct so far in 2025 using the State Library of New South Wales, the National Library of Australia and the National Archives of Australia, and show how a new account of polio that extends what we understand about the memory of polio alongside the history of vaccination, especially in a post-COVID era, can serve as a useful reinforcement of the value of my field, social history of health and medicine. This is a brochure from 1962, and I came across it in the State Library of New South Wales. I was looking for contextual information about polio in the State Library. The pamphlet was published and issued by the New South Wales Department of Health, as I said, in 1962. And it explains the causes of polio, how it spread, how to identify polio symptoms, how to prevent polio, how to treat symptoms, advice on keeping children home from school, as well as the after effects of polio infection itself. And a section on vaccination sets out the way a vaccine works with reference to the Salk vaccine, that was the first injectable vaccine, as well as the 3 identified types of virus and the process of vaccination. So by 1962, this is the kind of public health advice you would expect after several years of vaccination being available. It points out that some people can react badly to vaccination. It also reinforces the safety of the vaccine, and of course that was of concern, just as we have experienced in our own time with hesitancy and nervousness about vaccines. And it also talks about the use of the vaccine in close proximity to other vaccinations already provided for children, such as vaccination for diphtheria. So children by then were receiving early childhood vaccines and whooping cough. It states that the vaccination could be carried out by private doctors, such as general practitioners, a local council health department or a state immunisation centre in George Street, Sydney, with consent cards for vaccination available at councils, the state immunisation centre or at baby health centres. And it ends with 2 reminders. Today, poliomyelitis is a threat to us all. There is only one effective answer to it: vaccination. Vaccination is safe, simple and effective. It is your protection for yourself and your family. So by now, in 1962, at this point, you see a confidence about the public health message, and you see a sense of really trying to enable people to feel that confidence about the process, the potential kind of inflection points where people might be worried about vaccine, but also just getting people to be vaccinated. And in fact, the vaccination campaigns in Australia were pretty successful, as you can hear. So there are several book-length social histories of polio in the tradition of American public health histories of medicine, such as a book you might have come across by David Oshinsky, Polio, An American Story from 2005, and there are a couple of more recent ones as well. And Oshinsky's book weaves scientific, social and public health history together to reveal the extent of the panic about polio in mid-20th century American life. British scholarship includes focus studies of polio outbreaks and public health vaccine promotion, and I'll talk a little bit about some of that today. There's international literature about treatments such as those provided by Sister Elizabeth Kenny, an Australian nurse many of you will have heard of. And in fact, interestingly, that work is written by largely Naomi Rogers, who's an Australian historian who went to the US for her career and is still based at Yale University. And Kenny was responsible for what was regarded as very controversial but innovative medical treatment of children with polio, using warm compresses, physical movement and muscle re-education instead of constraints such as limb splits. If we go back to my opening where I talk about the criticism of the Orthopaedic Society levelled at what's happening in Newcastle in 1950 and 51, they were worried then about some of the treatments that were being offered, including the quick removal of limb splits. So that tells us something that I'll delve into more deeply about Newcastle's treatment regime. And there are also examples of polio illness memoir which point to the role of the personal narrative in creating a wider historical frame for curating and understanding the cultural memory of illness. And that's something that I find really fascinating. Australia had a higher median incidence of polio per 100,000 people in the population than both the United States and the United Kingdom across the 20th century. And that comes from World Health Organization data that was published in the 1950s and subsequently published in histories and so on. In Australia, New South Wales, Western Australia, South Australia and Queensland, there were all outbreaks of polio in the late 40s and 1950s. In 1951, almost 5,000 cases of polio were reported and there were over 1,000 deaths. Both cases and mortality declined dramatically after the introduction of vaccines. So you can see there the spikes and then the in relation to when vaccines were introduced, the decline. One thing I'm going to be doing in my project is using digital humanities techniques and designed by a digital humanities partner we have here at Newcastle that we work with. They're going to help me create a digital representation that maps these kinds of peaks and also the decline of vaccination across Australia, but also then links off to oral memories and stories. So it's going to be a kind of integrated piece of work, which is the major research output in many ways of the project. So those 1950s outbreaks followed earlier epidemics of polio in most places, including Tasmania and Victoria in the 1930s. And in 1937 and 1938, polio had spiked with 4,500 cases over those 2 years. I know that we don't know enough about First Nations experience of polio, and I'm doing what I can there, and I'm going to be trying to liaise with some community members to help me with that. Historical knowledge about Aboriginal Australians and polio experiences is relatively limited. Historians have noted the relatively low incidence of polio in remote Aboriginal populations in the 1930s and again in 1951. We don't know enough about whether Aboriginal people who lived on missions, for example, in New South Wales, were uniformly offered polio vaccines, although we can find information about some parts of Australia, like South Australia, through the research of Milton Lewis, who's written about public health and social justice. So I think that's a really important area of inquiry. I've also located some photographic evidence about this topic in state library collections, and it's likely that individual schools and missions shared public health promotional information on vaccines. And one thing I will talk about, I'll come back to it, but is the National Archives of Australia have some amazing records of the really assiduous and very kind of, focused attempts by public health authorities in Australia to track vaccination of remote children. So they actually wrote letters to schools in the Northern Territory to say, have these children been vaccinated? So I think it was an approach that was very careful and thoughtful and methodical there, which is interesting. So Kerry Hiley's book came out in 2015, and I don't want to suggest that there's nothing written because there is, and it's a terrific book. So I'm not going to produce a sole authored book from this project for that reason, but I am going to add to it because it's pre-COVID, so I think some of the exploration of vaccination history isn't as detailed, and that's where I see an opening for some of the work that I'm going to be doing. So she provides a rich and valuable historical overview of polio in Australia, and she does draw in part on existing oral history interviews limited to the state of Victoria. So my work will look across Australia and more broadly at all the oral history interviews that we can find. And it provides an overview of research about polio, but it leaves an analytical gap in terms of how evidence about polio shapes public memory of polio in our present. And surprisingly to me, there are no in-depth studies of the social acceptance of the polio vaccine in Australia. So the Salk vaccine was introduced in 1956, so it was available from 55 but not really widely used until 1956, and the Sabin oral polio vaccine in 1967. And that's a pattern that followed the vaccination model of Britain. So a lot of these Western countries were doing very similar things, and we're all liaising with each other about their delivery of vaccination programs. Now, this is evidence from a testimony from New South Wales Parliament House Standing Committee in March 2012, and it offers harrowing glimpses into the reality of polio for families. And I've come across very similar things in the oral history interviews that I've been listening to in the National Library. So in 1954, this person had just turned 6 years old and resumed school after summer holidays, came home with a headache, temperature, went to bed, and then the next day parents had to call the doctor, and then finally this person was taken to the Prince Henry Hospital. So there are lots and lots of stories like this of very sudden decline in children. It's really scary, if you're a parent, but even if you're not. And sometimes there's children really just presented as if they had flu or a bad cold, but it went downhill very, very quickly. What I find really interesting here is the middle paragraphs there. That would be the last time anyone would help our family out. No one would come near the house. The washing was still on the line and had to be dried by the fire at night. Everyone that we knew was frightened they would contract polio. That's a memory echoed in lots of the oral history interviews, and something that I checked with my Auntie Cathy, about my mother, and she didn't agree that it was quite that bad for them, although there are other family members that would suggest it was. So it's kind of interesting, the difference in remembering. This person also talks about going to different health facilities, including Margaret Reed Crippled Children's Home, and the lack of ability for parents to visit and see their children very regularly. So that's the type of story that I'm finding in a range of different records. And that tells me that that is a consistent experience there, because people are experiencing this in different parts of Australia over and over again. So given this story was replicated in many homes, communities also needed clear medical expertise to help shape approaches to polio. And as I mentioned at the outset of this talk, the Medical Journal of Australia extensively examined polio in 1952 across its issues, and they focused on things like laboratory science, epidemiological and public health aspects, diagnoses, orthopaedic management and rehabilitation. But that information was contained to those people who would have been reading the Medical Journal of Australia, including physicians and medical experts. There were other mechanisms to get information and knowledge circulating in the community, especially through the development of existing care organisations that had been around from the late 1920s. So I suggest that they had a bigger role to play than medical knowledge itself. Organisations like the Poliomyelitis Society of New South Wales appear to have played a central role in the dissemination of knowledge about polio, as well as about polio treatment, care and vaccination. Between 1957 and 1968, they were known as the Poliomyelitis and Physically Handicapped Society, and they grew from the charitable organisation Society for Crippled Children, which was founded by Rotary in 1929 to support children who suffered polio and tuberculosis. And Howard and I were just chatting about Rotary's interest in this project because they do have a very long history of association with the problem of polio. So I would suggest that this society and in its different manifestations over time played a very important role in disseminating information, but also practically supporting families. There are also a range of books published in the 1950s providing information about the experience of polio for children and their families, such as advice to parents. And there was kind of, fundraising appeals. This is actually from where they were based in Wilson's Point in Sydney, and reaching out to people, I guess, who might be inclined to donate money, so as a charitable opportunity, but also to organisations and, other sorts of bodies as well. So there's some very good evidence here about the kind of strenuous work they were doing through the 20th century. That document that I showed you before, My Child Has Polio, which was published, and that very sad plaintive face of a woman who is depicted there presumably as a mother. And then it explains in that brochure, the epidemic is widespread and serious, refers to the research in medical science and points to the need for vaccines. So constantly we have this reference to the value of the vaccine. That itself is an interesting public health message going out through an organisation devoted to the community, I would suggest. This I thought was very interesting. So this is from the PICS magazine. Some of you may know that the State Library of New South Wales was recently celebrating pics and the availability of some of these images. This is interesting because it says there on the front page a beautiful photo of these, lovely swimming girls, these beauties, and then it's got now is danger time for polio. And then, of course, I don't know that they were necessarily deliberately drawing that connection, but perhaps they were. So mixing and mingling in summertime crowds led to a discussion about the risks of polio and what was happening. This text here is from the Cooperator, and the Cooperator was a publication of the Poliomyelitis Society. The text here is designed for people going on door-knocking campaigns to raise money for polio care and suggests that the message about polio may have been less visible to people who were outside of the polio experience. So if you hadn't experienced polio in your own life or community, although it appears to have been a fairly widespread experience, you needed some reminders. And so they published these. You can see the way it was printed on one of those old sorts of pages that's been kind of run through the copier, and there's some hand drawings and there's some typewritten material. And they recommend to the fundraisers to use visuals. They want to use visual aids to get out there and talk to people in the community who might not understand the after effects of polio or what polio looks like, as it were. I find that really, really interesting. There are many annual reports through the 50s and 60s, and this journal, the Society's journal, the Cooperator, which ran for a short time, late 1950s to the early 1960s, and they provide a really, useful source of information about the themes of support to families living in different places and the work of the Society itself, including models for rehabilitation, and as indicated by the photographs in the publications. So the publications themselves have lots of photographs of rehabilitation settings of people who are receiving care, this type of thing, often placed in very positive light. So it's still possible to play sport, for example, even if you're physically compromised. And they tend to represent positive case studies and feature success stories of treatment. And this is partly to ensure the continued support for fundraising. It's a sort of really deliberate attempt to show how this is working. There are no first-hand written accounts of the experience of polio in materials like this, but I have seen a reference to a voluntary census of physical handicap reported in the Society's journal in 1959. I haven't located that yet, but I'm really, really hoping to, because I'd love to see what people reported, self-reported to that voluntary census. I've been on the hunt if anybody can help. The care of children and families who experience polio was very extensive in the wider community. And that's a reminder too, if we think about our present, of the previous ethos of voluntary work and the value of voluntarism, which has been commented on by the oral histories, the narratives in the oral histories that I've been researching in the National Library. And this image of young women playing with the ball with their crutches presents a fairly benign example of that. So the idea that you could be cared for in the community in this kind of positive way. However, there are many other images that depict adults in states of care and disability that would have been quite confronting, dependent on carers for a wide range of experiences. And those images too, the more painful images, may well have hit home in the message to supporters. I'm going to move now to a story about the vaccine, and hopefully the narrative here is kind of hanging together for you, because I'm trying to show how these pieces fit together in that public health message about polio in the mid-20th century. So against this backdrop of medical knowledge in the Medical Journal of Australia, organisational knowledge, organisational support and care for the many people affected, how did vaccines become a focus for the wider population? So Kerry Hiley, in her book that I've shown you, argues that in the aftermath of the epidemics of the 1930s, there was general agreement that population immunisation was vital to protect people from future epidemics. There was also vaccine experience, as I mentioned, such as for the bacterial infection diphtheria from the 1930s, and a combined vaccine for diphtheria, tetanus pertussis, whooping cough from 1953. We've come to rely on those in early childhood vaccine schedules now. So formal health education is an important theme for future and further research. Milton Lewis writes that in 1955, the National Federal Department of Health organised a seminar on health education at the Australian National University, together with the World Health Organisation, with state and territory representatives. So there starts to be this kind of dialogue between medical researchers and public health government. The Queensland Health Education Council became a model for other states from 1956 and comprised organisational representatives from a range of social organisations, media, government and the union movement. They focused on topics like accident prevention in homes, but also to improve public acceptance of the Salk polio vaccine in a campaign from July 1956. So it's interesting, if I refer to Milton Lewis for a moment, what was happening, and I'm going to tell you a little bit more briefly about the National Archives material that I found as well. So there was a massive immunisation program from late 1955. The Commonwealth supplied that, the Commonwealth government, free of charge, Salk vaccine to the states. So the states were in charge of the vaccine programs, the immunisation approaches. And mass immunisation began in mid-1956. And the vaccine was produced in Australia, in Victoria, at the Commonwealth Serum Laboratories. You might have heard about them in the news too, or recently. The share price kept going up and down. We need to sustain the work of the Commonwealth Serum Laboratories. That was produced in very strict conditions by people who'd done a lot of the medical research on the earlier vaccines and had collaborated with the US. And as I mentioned, the states organised their own campaigns for immunisation, and the general policy was that people under 14, pregnant women and those at high risk from contact would be immunised first. So just think back to COVID and sort of various vulnerable populations that we heard about. And there's some other detail here about these campaigns, but reported polio cases in Australia fell in 1956 from almost 1,200 to only one in 1966. So there's some other detail and data I won't try and pick out for you, but it's a pretty interesting account, and I really thank Milton Lewis for the kind of work he did to piece some of that together, because it's given me some clues about where to go to next. You can see here, this is the New South Wales Department of Health, Public Health Division, piece of information about poliomyelitis and the Salk vaccine, given out to health providers, I suspect, so that they can understand how to communicate to the public. In the National Archives so far, I've seen quite a lot of material yet to sort of really analyse this, fully analyse it, but a lot of primary sources that relate to state and federal government health departments and the National Health and Medical Research Council. And I'm really hoping to talk to some of our researchers here in health and medicine, because the National Health and Medical Research Council is such an interesting body. So I've seen epidemiological surveys, records of notification of polio. Obviously, it was a notifiable disease, you had to report it. Vaccination returns, so how many people are being vaccinated where. Letters between health agencies and remote schools, as I said, tracing children for vaccination. And official polio vaccine policy documents. There's quite a lot on how they came up with their policy about who to immunise. And correspondence between Australia and the UK and between states and jurisdictions. And there's even a medical research application from the 1930s, which tell us something very fascinating and funny, actually, about what it was like to request NH and MRC funding for medical research in the 1930s. So these days you have to go through incredible, extreme applications. I see Ruth there, you'll know what I'm talking about. In those days, you wrote a typewritten letter of about 3 pages and asked for the money. It's kind of incredible to me, so I find that really fascinating. And there's the files of the Poliomyelitis Committee, which are really rich on the vaccination campaigns of the 50s and 60s, so I'm looking forward to getting back into those. This is a poster from the National Archives, which says parents, guardians, and talks about the delay in vaccination being very dangerous. And there's a lot of photographic material that I'm yet to really get into, but some wonderful images at the State Library of New South Wales, also in Western Australia. The Medical Journal of Australia again published pieces about the polio vaccine in February 1956, so they kept the medical information knowledge production going through the decade. They explained the debate about the efficacy and safety of the Salk vaccine, including a crisis around the vaccine in the US, which led to some caution and hesitancy in other countries and delays, which is fair because they had to make sure it wasn't going to be damaging in public. And they talk about, they compare notes with what's happening in the UK, which is very interesting as well. One of the things I found about the UK corresponding with Australia was if there were post-war British immigrants coming to Australia, as we know there were in the 50s in large numbers, what kind of health support would they receive if they had polio? So what sort of things would they expect when they got to Australia? And what was it like to be a post-polio, they didn't use that term then, but what was it like to be in Australia if you needed to rely on public health? Really interesting. So there's a whole other seam of information there. And the Medical Journal in 1956 is very optimistic about the vaccine and also the scrutiny of the vaccine, referring to the National Health and Medical Research Council recommending in November 1955 that the Commonwealth Serum Laboratories in Melbourne manufacture and produce the Salk vaccine, but that it get thoroughly checked independently before it was used and rolled out, and that the use of the vaccine be restricted to state public health authorities until evaluation studies were carried out. So they're pretty careful. Preliminary online newspaper searches reveal multiple reports about the progress of the vaccine and its safety. Short, sharp updates in newspapers saying it's all good, vaccine's going well, some reactions reported, that type of thing, sort of relatively regularly through the newspapers. They also reported mishaps in vaccination and adverse results. So medical research at the Walter and Eliza Hall Institute in Victoria included a program that was focused on the development of vaccines. And in the 1940s, Frank McFarlane Burnett, whose papers are in the University of Melbourne Archives, was assistant director of the Walter and Eliza Hall Institute from 1928, and he worked alongside someone you might have heard of, scientist Jean McNamara in the 1930s, and they did scientific research into serum technology. Together they maintained scientific research contact with Simon Flexner, who was the head of the Rockefeller Institute in the US. They gathered strains of polio virus and helped to differentiate the 3 identified strains of the virus. Australians, therefore, can be commended for their work in helping produce the Salk vaccine. Australia was well placed to have an informed scientific research position on polio, as well as on the approaches taken worldwide. And Australia actually supplied New Zealand with vaccines. There's a really interesting story to be told here about our prominence in this. Like Canada, Australia displayed more confident uptake of the vaccine when compared to Britain, perhaps because the rates of infection were higher here. And Australia enjoyed much success, more success than in New Zealand. By 1958, more than 95% of school children had been vaccinated with the Salk vaccine. Now, it's useful to remind ourselves here that in the 1950s, there was an expansive sense of confidence in the potential of breakthrough cures for diseases. And it's something that historians of medicine argue rarely ever occurs and actually occurs, right? So it's in this case, the reality of what happened with the Salk vaccine and the success aligns with the optimism of the confidence in public health. A 1976 history of the New South Wales Society for Crippled Children makes mention of the joy occasioned on the elimination of polio. The introduction of the Salk vaccine, coupled with the general immunisation of children at an early age, had a dramatic effect. I'm quoting here. It is well nigh impossible to estimate the tremendous relief that this advance brought to Australians. So the confidence in the vaccine had been being built. I will come to an end soon, but I just want to say I was going to refer to the literature about what's happening in Britain. I'll just very briefly say that there's a terrific article by British historians Hannah Elizabeth, Gareth Millward and Alex Mould, whose name you may know if you've done some research in this area, who look at the phases of polio vaccination, health promotion, and it's called Injections While You Dance, because they promoted polio vaccine to young people who were going to social occasions and they would turn up to the hall and get vaccinated as well as socialise. So, yeah, pretty interesting scholarship. There's a little lineup of schoolgirls waiting for their vaccine. That's from the State Library of New South Wales digital collection. Okay, I just want to finish up by talking about the introduction of the Sabin oral polio vaccine from 1966. I am looking for a PhD student to work on the history of vaccination with me, so just trying to hard sell here. So back in Australia, by 1957, the Medical Journal of Australia was reviewing the state of the disease and its prevention and referring to the Sabin oral polio vaccine in development. Sabin, different researchers, so Salk and Sabin were both competing, for their honours as vaccine technology was being developed through the 50s. Sabin used a live virus as opposed to the deactivated or killed virus strain that was used in the Salk vaccine. And the Medical Journal of Australia starts to really promote this because of the medical technology breakthrough. It was easier to dispense this oral vaccine to children. They used it on sugar cubes and in little pink cup, as I remember, a pink syrup drink. It was also easier to distribute in Australia to remote Aboriginal communities, and there's some really good stories about that, flying nurse service in Western Australia, for example, but also to the world's populations, remote populations as well, because it required little in the way of vaccine protocol, unlike the injectable vaccine. And it created additional benefits for populations through the excretion of the live virus. I think there's something really interesting to say about the introduction of the Sabin vaccine if somebody researches that. So there's here you can see the campaign from Arnold Yago, who was the Liberal member for Gordon in the New South Wales State Parliament from 1962 to 1973, and a State Minister for Health. And he issues a memorandum about the new New South Wales campaign to use the Sabin oral polio vaccine. And it points to recognisable patterns in the promotion of vaccines to different age cohorts. It's a social responsibility of all of us to ensure that this campaign is highly successful, and your active support will contribute greatly to this end. So the new opportunity of the vaccine here is that it can be, as I said, more easily dispensed and dispersed, but it also captures a new generation because, after a while, when we get used to vaccines, they forget about it. They have to be reminded because the incidence of polio has started to decline. So that's another thing that we can relate to in our present.
Sorry.
That was very beautiful. This is a little leaflet about the Sabin vaccination against polio from our Copley collection here that we refer to in our exhibition downstairs, which I hope you will go down to visit. Okay, I'm going to come to some conclusions now. And I hope I'll leave a little bit of time for some questions. I'm sorry if I haven't, but I'll do my best. One of the first inspirations for this research was teaching a first-year global histories of the 20th century course when I was working in New Zealand. And it drew on the BBC PBS television series, The People's Century. And it has a number of episodes across that series. I don't know if any of you have watched it, but it's got amazing footage in it. It's great for teaching. The episode Living Longer, 1954, featured scary black and white footage of polio, personified as a creeping, looming, monstrous shadow that was used in public health messaging in Britain in the 1940s. The visual messaging and accompanying narrative also perpetuated now outdated links between polio infection, dirt, and poverty. So I think the idea for this project has been lurking in my mind since I did that teaching many years ago because I knew about my mum's experience. And I hadn't really had the headspace to sort of get into it until now. Polio still casts this grim shadow over the history of public health in Australia, and the numbers of Australians in our community now, older people who are living with after effects of post-polio, has been estimated a few years ago in the tens of thousands. So where can we go from here? I suggest that historians of health and medicine can offer a full account of the complexity of illness and its meanings through the multiplicity of encounters between patients, institutions, organisations and physicians, as well as through these localised experiences and understandings of disease and treatments. And I think this will involve a critical examination of the vaccine in private and public life. So the oral histories I've been listening to are telling us about the experience of the vaccine as well. Okay, I will come to an end, and I'll just say that my future work with the ARC project, as I've mentioned, will involve this digital mapping and a link to these history collections around Australia so that we can enable all of you, public users, to find information about polio's history really easily and in a more dynamic format. But I also really want to get back to the National Archives of Australia with over 300 records of poliomyelitis, including that scientific material produced by the NHMRC and the introduction of vaccines, as well as some really interesting materials held by the National Film and Sound Archive, which I'm making a time to see. So they have some short films of people on health camps, children with polio, that I'm interested to view. I really, really appreciate you coming to listen, and I hope that the story, the way I put it together, hung together for you today. Thanks very much for your attention. Thank you.
Thank you, Cathy, and congratulations on just such a wonderful, fascinating piece of research. I know it's personal and quite significant. Now, has anyone got any questions and would like to ask Cathy before we finish up and go downstairs for morning tea?
Also happy to have ideas. Sorry.
That was amazing, and I'm really struck by the thing you briefly mentioned about British polio survivors coming to Australia. I'm very at the time when Australia was trying to attract migrants in that post-war period, one of the main questions that they were asking as a screening question for anybody who wasn't British was, are you going to be a financial burden on the country? That seems remarkably different.
Yeah.
What's going on there?
Yeah, well, thank you very much for drawing attention to that, because I find it fascinating as well. Well, I think there's a shared global understanding of the fact that there's a kind of mission to help and support people with polio, because it really was a global situation and they were exchanging information about vaccination campaigns. So I actually read that letter as a kind of cautious little kind of, oh, can we talk about this? Because people are asking us if they come to Australia, are they able to access your services? And there is a longer reply, so I'm yet to sort of analyse all the material, and I'll talk to you about it when I do. But yeah, I found it as fascinating as you, actually. So it's a shared community of people responding to polio is what I read into that. Yeah.
Shaped by the Commonwealth?
Yes, I think so, absolutely, because they were sharing information about, well, particularly because Australians were involved in the medical research and liaising with the American side of the scientific research. And in terms of Britain, they were taking advice about the public health, which I think in Britain the public health infrastructure is probably more developed around, delivering the vaccine, how to deliver it to their population. So I think that's a big collaboration, which is very interesting.
It probably relates to that question when you mentioned about the remote communities and Indigenous aspect, and talking about the British. Was there an effort to try and get the message out clearly to non-English speaking background people, so multicultural? Because I mean, when you look at the policies of the time, just a lot of that was directed, obviously. So did we make any effort to put it in languages other than English?
Oh, that's so interesting. No, thanks for mentioning that. I haven't come across anything, but now I'll be on the lookout for it. Absolutely, yeah. Something tells me if it doesn't exist, unless there are Englishes other than language newspapers at that time where I could maybe do that research, that might be the way to look at that. Good question. Yeah. Thank you, Jen.
Catherine, nowadays, in certain sectors, there would be total resistance to the idea of a vaccine for anything, unfortunately. Did you get a sense in your preliminary research of resistance to polio vaccine for a while? And do you also have a sense as to how they managed to get through that problem to make sure everybody got the vaccine they needed?
Yeah, that's a great question. Another thing I found in the National Archives is correspondence with Menzies, Prime Minister, which came from fringe groups who were anti-vaccine, and they also were anti-Semitic. And because Salk was a Jewish researcher. So there's a big debate globally about that, and I think people have written about this too, about anti-Semitism towards the vaccine in the US as well. And what I find really interesting about Menzies is he basically just writes this memo saying, not in so many words, but basically, they're crackpots, let's ignore them and just push on. And you kind of wish that would happen more now. But I love it. I took an image of it. The National Archives it was new to me because my other research I haven't really used it. So in terms of what I can find there, but it's very rich on this material, the political material about vaccination. So yes, I mean in terms of Australia, I think they just pushed on and pushed through, and they just got it done. So there were little pamphlets published by different groups sort of worrying about the vaccine, but they were basically seen as fringe views, interestingly. But I'll have to think about that some more as well.
Was it just jumping on the back of that actually? Thinking COVID, did they implement any vaccine regulations that forced people to get it? Otherwise, they limiting things, or because it was such a big thing, then that big influx was just people doing it out, doing it themselves.
Yeah, not to my knowledge. I think it was much more of a kind of make sure you do this. The letters trying to trace children because they needed three injections of Salk. And they were really particularly in the Northern Territory, they were really worried about children who may have only had one and then were potentially moving schools or moving away. So they were I think, probably mostly focused on Indigenous children, but also all children who were at school in the Northern Territory. So there was a lot of correspondence about that, which fascinated me, that they followed up. But I don't think it ever resulted in, mandates or regulations, but to the best of my knowledge, it was more of a persuasive kind of piece of work. I could be wrong.
Lisa, did you give me a sense from your research around the fact that quite prominent individuals have caught polio, so there was an American president, Kim Beazley, you mentioned.
Yeah.
Did that help with the vaccination after?
That's interesting. Yeah, I don't know that it happened at the time. I think in retrospect, it's a really interesting question, but there are quite a few people we would regard now as famous Australians, but I think the feeling that I'm getting from these records is that it sort of astounds me. People just got on with it, pushed through, became very practical, very focused on care and outcomes and positivity. They put up with a lot more than we would, I suspect. And there's a sense that the stoicism then comes into people's memories, and people either didn't talk about it, there's a stigma attached to it as well, or they just had got on with it. And therefore the period we're in now, where we've seen in news stories came out about John Laws, apparently he got polio twice. They are now cause celebs because we know those people's names. But at the time, I think, they were just, their families, they were just getting, even people like Alan Marshall, I mean, his story of polio has become a favourite for readers, for decades. But I looked at his records in the National Library, and a lot of his own writing didn't attend to questions of polio at all. So there's the book, which is a novel memoir, but then a lot of his work was about all sorts of other topics. So he didn't sort of become a crusader about polio in his lifetime at all. But it's really interesting. Yeah. Good question. Yeah. Hi.
So let's go back to we donate a bit of money to the government. Should we help with the government the way that we should be helping with the people that have COVID and to have that try to fight COVID off? Way that what I just describe it is we donate some of the collector's items.
Yeah.
that money should go back to the government to help us with the COVID.
Yeah, okay. If I'm thinking, if I'm understanding you correctly, are you talking about polio survivors now getting help in the communities for what they went through? There are organisations that are caring for people with post-polio, and they do, I don't know how much fundraising they do, but they do get a bit of money here and there from government sources and that type of thing. But I'm not quite sure if I've got the gist of it right, but yeah.
Yeah, it could be just like the public health campaigns, the funding around supporting vaccinations for pandemics.
Yeah.
Is that what you mean, Mitch? Like that public sort of support and campaigning around such big pandemics.
Right. Okay. Yeah.
And Australia typically has really strong campaign, health campaigns and archive. My question was, I guess in Australia's the archive, the National Archive, as rich as other countries, like.
Yeah. Okay. In terms of what they have on polio in particular, yeah. So this is at the heart of my whole project actually. And then I know you need to do morning tea, but the National Library of Australia started collecting oral interviews in the 2010s. And they've got 33. So there are 33 interviews conducted by one researcher. The National Library put out a tender and they wanted to do this kind of work in their old history collection. They were particularly interested because people of that generation, obviously they're getting older, so it was important to interview them. And they've got that nice body of material. I've been able to get access to probably almost a bit over 2/3 of those. Some of them are not accessible to me, but that's a pretty good hit rate. I had to get permission to quote the pieces in the conversation. It's really important, So some of the people have passed away. Others, their families are paying attention to how we use their interviews. I think now the rest of my task, which is a nice note to end on, really, is that I'm looking at other collections around Australia. Internationally, I don't know. I'm not looking outside Australia at those collections, but that is curious to me, and I will look. But there's pockets. There's community libraries that have one or two. Our library's got one of a carer. I'm not taking new oral histories because I'm focusing on using the existing ones, but we might be able to collect a few in the library, as we've talked about. So it's just very interesting to me, and I don't know. One thing I noticed though is the National Library has a dedicated oral history librarian curator, and they've also embarked on a COVID collection. So the COVID collection will be the next one that people want to get and analyse for the experiences of illness. I'll be one of those people, and and thinking about what that all looks like. Thank you.
Well, join me in thanking you.